programa más de Dr. Lizi. Bienvenido a toda la familia de Retos Femeninos y bienvenido tú. Muchas gracias por estar en este espacio de crecimiento, de aprendizaje, donde tengo la bendición de entrevistar a personas maravillosas, como al doctor Bauman, que lo voy a entrevistar el día de hoy. Así que si tú has sufrido por temas de tu cabello, se te está cayendo, te peinas y ves que se caen todos los cabellos por todas partes. Bueno, déjame decirte que nuestro invitado de hoy es un súper especialista mundial en restauración capilar, que ha tratado a más de 34,000 pacientes, ha realizado más de 13,000 procedimientos de trasplante capilar y más de 12,000 PRP, que son el plasma rico en plaquetas, desde que él comenzó su práctica en 1997, que se llama Bauman Médico, que en realidad es un hospital capilar de última generación en el corazón de Boca Ratón. El doctor Bauman es conocido por ser un pionero en numerosas tecnologías en el campo de la restauración capilar. A lo mejor lo has visto en NBC Today o en CBS Early Show o en el ABC Good Morning America o en CNN o en The Doctors o en The Bald Truth of Spencer Coburn, en Bluetooth Radio con mi querido Dave Asprey o en Men's Health, en GQ, en Vogue, en Harper's Bazaar, en New York Times, en Opera Magazine y muchas más, porque el doctor Bauman fue elegido el número 1 cirujano en restauración capilar en Norteamérica y lo ha sido durante 8 años consecutivos. Y Forbes también lo ha reconocido como uno de los 10 CEOs que están transformando la atención médica en Estados Unidos. Entonces, ¿cómo no voy a sentirme profundamente orgullosa de poderles presentar a un hombre, a uno más que está cambiando la historia de la salud? Y fíjense que el tema de la Bauman con nosotros. Ahorita que me avise Gaby que ya está el doctor Bauman, pero causa a muchas personas, ahí está el doctor Bauman. Hey, Dr. Bauman, Alan, how are you?
Hey, I'm doing fine. How are you doing?
Such a pleasure to see you, Alan.
Great to see you
How's
too,
the
Lizzie.
family?
Everybody's doing great.
And how's the hair doing? Yours is amazing. Every day
Well,
it's
so far so
better.
good,
Oh
you
my
know.
God.
Well, I fight like hell to keep it, so I do my best.
Alan, I want to thank you for being with us today. I did a huge introduction.
I heard most of it.
I spent hours doing it, but thank all the people that are joining. Esta entrevista la voy a hacer en inglés, amigas y amigos, porque Dr. Bauman no habla español. But Alan, I would like to introduce you in English too, because maybe somebody doesn't know you. And if they don't, I want them to really know you. And I want you in Mexico very soon. But Dr. Alan Bauman, which is here in the show today, is a hair restoration physician who has treated over 34,000 patients. Dr. Bauman has a state-of-the-art hair hospital in the heart of Boca Raton since 1997, which is a long time. And he's known for pioneering in so many technologies in the field of hair restoration. And maybe you've seen Alan in NBC Today or in CBS Early Show, in the ABC Good Morning America, and CNN, the doctors. Well, Dr. Bauman in Bulletproof Radio with dear Dave Asprey and Men's Health, Vogue, Harper's Bazaar, the New York Times, Opera Magazine, and many more. And you have been voted #1 hair restoration surgeon in North America for 8 consecutive years. And Forbes also has recognized you as one of the 10 CEOs transforming healthcare in the United States. So imagine if I don't feel proud of having you in the show. Thank you, and thank you for putting your superpower to help many other people. Yo como voy a acercar, Gaby.
Well,
so how are you doing? And what's this with
everything,
the hair loss?
yeah.
People suffer with this. Emotionally, it's very traumatic.
No, absolutely, absolutely. And thank you so much for having me. And that was a beautiful introduction. I really appreciate you.
Well, it's from the heart because you're an amazing, you're an amazing human being, and you're a friend of one of my great friends, Dr. Fab. And seeing you in the Dave Asprey event and talking about this and treating Dave Asprey, and I mean, your team is amazing, you're amazing, and you've helped many people solve something that can be very traumatizing. And I'm not exaggerating because they think it's a men's thing. But it's a men's, gracias, Gabi, and it's a men's and women's issue. So thanks for being on the show. And like, there's so many questions I have for you, but the first one is why? Why of all the fields, why did you choose this? What personal impact did this have in your life?
Yes. Well, way back when I was thinking about going to medical school and even thinking about what area of medicine I wanted to practice, I really didn't know anything about hair transplantation at all. And really the only thing I knew about hair loss is that my dad suffered from it. And, he had worn a hairpiece for a very long time. So I knew hair loss was an issue, but my main goal was plastic surgery and reconstructive surgery. My first mentor, really, truly in surgery, was a plastic and reconstructive surgeon. And it wasn't until many years later on when I went into my internship and residency program, did I actually learn about hair transplantation. And I didn't learn about it from a professor or a surgeon. I learned about it from a patient. And that patient was having another cosmetic procedure done, and he told me that he had had a hair transplant. And I honestly couldn't tell. His hair transplant looked amazing. And I told him so. And he was, of course, very flattered. And he explained to me in a very brief conversation about the latest and greatest hair transplants, because I thought back in the 1990s that hair transplantation was just pluggy and painful. And why would you ever do that? And his looked great. And so he told me about single hair follicle implantation and where he went to and the surgeon that he researched and all of that. And it sounded very exciting and very intriguing to me. So that kind of started me on my path. And the other thing that he imparted to me was how the hair restoration changed his life. And what he's told me about his life socially and professionally since he had the hair transplant, it was never the same. It was so much for the better. And it really, truly improved his lifestyle, his job opportunities, his social life. And so that kind of stuck with me. I mean, I already knew cosmetic procedures and treatments could have that effect, but I didn't really know much about hair. And so over the years, months and years later, I eventually learned more about hair restoration, dove into it in terms of looking at research, journal articles, textbooks, eventually going to conferences and meeting with surgeons and visiting surgeons, both nationally and internationally, to see what was being done in the field of hair restoration. And the more that I saw, the more I loved it. And I thought originally I was going to just add it to my plastic surgery practice, but then it just kind of absorbed my entire brain. And I also realized it takes a lot of effort and energy to perform this procedure correctly. And that's how I got started. In 1997, I moved to Boca Raton, Florida after my training in New York. And I moved down with my wife and we opened the practice. And I started to treat hair loss patients. And today I'm blessed. I've treated over 34,000 patients and hopefully changed their lives for the better by helping them maintain and restore their own living and growing hair. And it's fun. It's a fun practice to have. And it's so fast, like 26 years, so quick.
You're just starting, Doc, with this biohacking going on. Prepare yourself for the next 80. So I don't know what's going to be happening then. But I have a very important question to ask you.
Okay.
What would be the main causes of hair loss in women and men? Because when people start losing their hair, they get very anxious.
Sure.
I think we do things that we shouldn't do. I would really love you to tell what not to do. What don't run in a panic attack to do, and what yes to do, right? And what really helps. But what's the cause? Because many people question themselves. Is it nerves? Is it anxiety? Is it genetic? Is it my nutrition? Is my gut sick? What are the main causes, Doc?
Well, you've touched on a lot of lifestyle factors that can definitely influence your hair. But today we know that hair loss is mostly genetic. It comes from the mom side or the dad side of the family, and it's passed along in your genes. And so What mostly happens, for example, in men, when they, could happen to them anytime after puberty, is the sensitivity to DHT, dihydrotestosterone in their body, causes the hair follicles to miniaturize in the very recognizable pattern, receding hairline, thinning in the crown, and you can get total baldness at the top. In women, it happens usually a little bit later on in life, but still it can happen in the years of childbearing age when you have a sensitivity to androgens, like in, for example, PCOS, which is the most common hormone abnormality of women in childbearing age. But sometimes it takes a hormone shift or change, like childbirth or menopause, to really see the hair loss occur. And of course, hair loss in women looks a little bit different. It doesn't cause a big bald spot on the back of their head typically. It's a generalized diffuse thinning in the front, and it can recede a little bit later on in the hairline. Sometimes you feel it in the ponytail volume, or you see this excessive shedding, or change in just the overall volume, texture, color, and health of your hair with time.
Wow. And in my case, I think it had to do with my long COVID, which took me to biohacking, but I felt very sick. So I imagine that poor nutrition, a lot of stress, I don't know if depression can influence also the loss of hair, right, Doc?
Well, absolutely. Well, first of all, stress can cause hair loss, and then also hair loss can cause a lot of stress. So sometimes it's a downward spiral, but you're absolutely right. Hair follicles are some of the most highly metabolic cells in your entire body. So they can be affected by changes in your diet, your nutritional status, your absorption. You mentioned COVID. I've treated over 1,000 COVID hair loss patients. The spike protein that you get with COVID dysregulates your immune system. It can impact your circulatory system. It can give you a fever, almost like a flu symptom, of course. And even the vaccinations, which impart the spike protein into the body, can dysregulate those organ systems and affect your hair. So it's not uncommon that COVID, long COVID, can certainly result in a lot of hair loss. But the good news is that we have a lot of great ways to treat hair loss, and to stop the shedding.
What is there
things
today
like that.
that really works? I mean, you know that I want your clinic in Mexico because I want many people. No, really. I mean, it's a great idea to go to Boca Raton, but there's so many Spanish-speaking people that also have this situation that can cause a low self-esteem and more anxiety and more loss of hair and doing things that you shouldn't do. I really want to ask you what are the best treatments available, but also what we should not do. Because when panic hits, people do dumb things. So what are the dumb things that we shouldn't do if our hair is starting to...
Yes, so that's very, very common. Panic sets in, you see the extra shedding in the brush or the shower drain or things like that, and you start to go online and search for these magical cures. And so the latest TikTok cures are not going to be good for your hair. So slathering essential oils into your scalp, if you have a true hair loss problem, could actually make the situation worse if you become sensitive to those oils or things like that. So first of all, I would say just take a deep breath. It's going to be okay. You need to get yourself connected with a board-certified hair restoration physician. And whether it's myself or others around, there's about 200 of us in the world that are board-certified in hair restoration surgery and procedures and treatments, because you need an accurate diagnosis. Did you have COVID? Did you lose weight? Do you have malabsorption? Are there other issues in terms of your sleep-wake cycles and things like that that could be affecting your hair? Do you have an underlying medical condition? Are you taking medications like antidepressants, blood pressure medications, cholesterol medications? These can all affect your hair. And so we want to dissect down into all of those other factors, as well as, do you have hair loss in the family, mom's side or dad's side? And then we take a very holistic approach in my clinic to see what's going on. We will measure you. And so even though we can connect virtually, and very often many of our patients do, and even from Mexico, I have a large cohort from Mexico City, actually, that do come into Boca quite regularly. But we first connect online and we evaluate your situation and see what's really going on. Do we need to do any blood work or other evaluations to see what's happening? We can check all of that from a distance. when you do come into the office, we're actually going to use microscopes to measure your hair. So the microscopes today don't just take microscopic photos of your scalp, but they use artificial intelligence to count the hairs, to look at the thickness of the hairs, and to track over time, not just your baseline, where you're started at, but whatever therapies and treatments we decide we're going to use, we can track the progress. And you saw this at the biohacking conference when we used the AI-powered microscope called the Hairmetrics on your scalp at the booth when we were there.
Yeah, I love to be there. You know, the other thing that I use, because when we're talking about treatments available today, and not only in your clinic, obviously, but I truly think you're an amazing doctor, but also an amazing human being, which is consciously trying, and not only trying, doing or making a difference in the world, which is helping many people. Because one of the myths about hair loss is, oh, I know that when I get older, I'm going to lose my hair. It's like those that stress when it starts happening, but then it becomes like that's life. It's like that. I'm not even going to suffer about it, but they do. They actually do. So I don't want to normalize something that shouldn't be normalized, because that's what biohacking is about. Even if your family is in the hair loss group, doesn't mean you have to fall in it, right?
No, you don't have to accept it today. And that's the beautiful thing about the technologies that we have and the various treatments. So, we can start with simple things that are non-medical, non-pharmaceutical, just good nutrients, good fuel for those hair follicles that are so highly metabolic, whether it's protein, vitamins, minerals, things like that. There may be great herbs for women who are dealing with postmenopause and things like that. We can use non-chemical treatments like laser light therapy, a very effective treatment. And of course, we have the turbo laser cap. I remember you tried it on, and that's FDA cleared for hair regrowth.
With the laser cap, you know why? Because I was even thinking that I could use it with my brain tap while I'm brain tapping. Because you put it in your head, you can sit down, you can be working, and it's so cool. But lead, for example, this remember the name of the one you put in my head in the Dave Asprey biohacking conference?
The turbo laser cap, yes.
Why is it so good? Because you can use it 20 minutes, 10, right?
Not even. It's a 5-minute device. And so just remember, I was one of the first to use laser light therapy in the practice. I got my first laser for hair regrowth back in the 1990s. So it was 1999, 1998 when I received the first in-office laser. It was huge. It was, 6 feet tall. It was massive. And today, inventors like Dr. Michael Rabin of the original laser cap company, he invented a great device that was portable, that you could use at home. And so that's where the laser cap really got its birth in Cleveland, Ohio. But we've reimagined the laser cap in this turbo version, which makes it more portable, more powerful, quickest treatment time on the planet. It's got 5 minutes and you'll get treatment over 25% more coverage. So all the way from the hairline, way back into the occipital or nape of the neck, if you will, you're going to get an increase in blood circulation and an improvement in hair growth over time. And the device is excellent. It's got a lifetime warranty. Obviously, we prescribe and dispense a lot of the turbo laser caps. So, and in fact, at the booth, we ran out of them.
And you don't have it nearby.
I do.
So people,
of course, I have it nearby.
Cool.
Yeah. So
because it's so cool. Look at that. Yeah.
Yeah. So this is the device. You can see it's flexible, and inside there's hundreds and hundreds of lasers in there. And of course, we can maybe be able to light it up if I can find a battery pack. But when you unsnap it,
like a travel one, no, that's very one that doesn't weigh anything. Yes, it's amazing. So,
correct. So it's going to be very, very portable because it packs completely flat for travel. It unsnaps and it's completely flexible and portable. So this is how you pack it in your luggage or in your backpack. And then when you're ready to use it, you just snap it together and you're ready to go. So it's a great device. Of course, multi-therapy wins the day. So lasers can be combined with other treatments. It can be combined with your good nutritionals and nutraceuticals. It can be combined with medications. It can be combined with regenerative treatments, things that we do in the office, like PRP, platelet-rich plasma, growth factors and peptides, with the TED treatment that you saw that we had. Those are all great ways to get the existing hair to crank up and grow better, stronger, and healthier so that you don't lose the function of the follicles.
That's amazing. It's amazing. And also there's been so much change or revolution in the transplant procedures that we were talking about at the beginning of the show. Mm-hmm. That you could see the hair like sticking in, like if it were. Yes. I remember my dad having one when it started, really, and it wasn't comfortable. It was painful, and it wasn't cool. But it's another world in hair transplant today, right?
Oh, it's true. Hair transplants have come light years since I started in the field over 26 years ago. We used to take a strip, which required a scalpel and stitches in the back of your head and left you with an old linear scar. Today, we can take the follicles as little as a single hair follicle at a time, meaning a single follicular unit graft, which is smaller. It's harvested with a device smaller than the tip of a ballpoint pen. And we can harvest those follicles from the back and we apply them into the thinning or the balding areas. But it's not just the location that's important. It's not just the shape of the hairline to make it look good, but it's actually the angle of the hair that is critical in order for it to look correct. And that's the artistic step of the process. So there's a lot of technology over here, but there's also a lot of artistry on the other side as well to make it work together. But the good news is there's no linear scar. You can be back in the gym in 3 or 4 days. You can be completely crust-free and healed in less than a week, and you're back to your regular routine. And then you just have to wait for the hair to grow. And so for both men and for women, hair transplantation can be an option if the follicles are dead and gone in those areas, and the scalp is healthy, as long as the scalp is healthy.
Well, we need to go visit you soon.
Well,
and we'll do a show from the clinic. That would be amazing.
Yes. You should come up anytime. We can broadcast live. And don't forget, for your listeners, we also do eyelash and eyebrow transplantation, which is very popular in our women, and also women who have had plastic surgery procedures like scars left over from brow lifts or face lifts. That's a very, very popular treatment option to cover those telltale signs that you've had something done.
Wow. I definitely have to go meet you at the clinic, and we will do a live from there, showing the people everything you have that is incredible. So don't accept hair loss as something that is normal and that you have to grow old and bald. That's not true.
No.
To finish the show, Doc, for the people that are watching and that are giving us the most important thing that they have, that is their time, as you to us here in the Spanish-speaking community. And I'm very happy that this show is going to have subtitles, because I always want to open windows of opportunity. And I've thought that the language, even though sometimes it's hard for me to express myself the same way in English as I do in Spanish, which is my main first language, I think should not be a barrier for health. And for us meeting, if I had the blessing of meeting you through FAB, and then with Dave Asprey and with Dr. Patrick Porter, which is amazing human beings that are changing the world, I want them to know you too. But for those that are worried because their hair is starting to shed, I don't know how you say it in English, but it's falling. What would you recommend? Like your Allen tip for those who are about to have that panic attack and you want to hurry to the pharmacy and get the first product you find for hair growth?
Well, just remember, first of all, this is Hair Loss Awareness Month, and the headline is Time Equals Follicles. And what that means is that with time, the hair loss process can get worse without treatment. So it's really important to seek treatment early. That you'll have the best chance of results and the best possible results if you take action early. And the best possible action, whether you're seeing excessive shedding or you're seeing a little bit of thinning or receding, or there's a man in your family who's got a receding hairline or a bald spot developing, or God forbid you've had some kind of trauma, whether it be psychological trauma or physical trauma that has hurt your hair, reach out and get some good advice. And so I always say, take action. You can read about my clinic at baumanmedical.com. It's a great place to see the information. I've also got some exciting news for you as well, because aside from all the video content that's on the website, hundreds of hours, I'm also getting an AI avatar that's going to be loaded with all of my information, and it will be able to speak 10 different languages, including Spanish. So it's coming soon. It's not ready yet, but I'm working with an incredible company that's putting that together for us. And we already have the prototypes here in the office. They have my AI avatar. So this is my virtual self that you could potentially be speaking with, who will just be loaded with all of my information that I've ever written down when it comes to hair loss. So obviously that'll be a good first place to start, but obviously getting the evaluation, getting the measurements are the critical steps so you can track your progress. Because most people start treatment, they get very excited, they get things going, but they fall off the regimen. They stop their treatment well before the results are noticeable. So this is very common in cosmetic procedures and treatments, and even weight loss. You start a diet, you start an exercise regimen, you start a fasting, intermittent, whatever, and then all of a sudden, within a few short weeks, before you even see the benefit, you're off the regimen. That's not so good. So the measurements,
habits, right?
Yeah.
We have to pass that curve. That is when we don't see the results, but we're doing everything and they don't seem to pop up. That's when you have to keep on going, because when you make it, at least for 3 months, and make it a habit, then it has to be a habit in your life. It's a good habit.
Yes, if you want your hair, you can keep your hair. That's what we say, So you have the option.
My brother is a dentist in Miami, and once I told him, hey, he's Luis. His name is Luis, but we call him Lucho. And I told him, hey, Lucho, how important is it to use the dental floss? Do you have to floss every day? He told me it depends how many teeth you want to keep. Got it.
Exactly. So I understand that very well, because my dad is a dentist and he's very keen on being proactive when it comes to dentistry. And I think that's where I learned my prevention skills that I have now dovetailed into the field of hair loss. And so, yeah, my dad is still practicing dentistry up in New Jersey. He's in his 80s, 2 days a week. But he's, I wouldn't say he's a biohacker, but he's definitely living large. Both my parents are doing great out there. So
for many years, we want him retired.
Yeah,
that's going to be hard, right?
Yeah, I don't think he's looking to retire. I think he enjoys what he does, and he sees about 8 or 10 patients a week, and that's what he likes.
Well, the importance that he has a good life, and that's what we're all looking to have. But it's not just looking at it; it's actually becoming it. And I really want to thank you for this show, for giving me your time, which is the most important thing you have, which I know you're super busy. And to all the Spanish-speaking people, to let them know that this is going to have subtitles. And when we get your avatar ready, we can do another show so they can hear everything in Spanish that you have to say. But I love it. And it's so nice always to see you.
Great to see you too. Thank you so much for having me, Lizzie, and hopefully we'll connect soon.
Of course. Take care, and thanks a lot, Alan. God bless you. Thank you. Bye-bye. Acuérdense, busquen al doctor Alan Bauman en baumanmedical.com. Nos estaba contando ahorita en la entrevista que tuve con él que ya va a estar toda su información en 10 idiomas, todo lo que he escrito desde 1997 sobre la caída y la restauración del cabello. Entonces, pues qué emoción que, aunque esté en boca ratón, lo vamos a poder tener en español todos, porque como él dice, hay que primero checar lo que está sucediendo, qué es lo que está sucediendo que te está haciendo que se te caiga el pelo, y hacer una buena evaluación es fundamental. Así que sí tiene pacientes mexicanos, y ahorita yo les dejo toda la información del doctor Bauman. Gracias a ti por dedicarme lo más importante que tienes, que es tu tiempo, y que lo dediques a querer sentirte y verte cada día mejor. Que nos vaya muy, pero muy bien.